COPD, which is the same thing as emphysema, is a very common, preventable, treatable disease that unfortunately tends to be progressive. COPD involves a problem of getting air out. So people with COPD can breathe in just fine, just as normal as anybody. When they blow out, their airways collapse and then the air gets trapped in their chest.
Now that you have a better understanding of what COPD means, we're going to talk about the most important thing you can do for your health.
So what we need to remember with COPD is that when we move slower, we can move further. Every time we cut our speed in half, we double our distance. Every time we cut our breathing rate in half, we double the amount of air we move. The things that are most important for COPD are stopping smoking, which we've already talked about, we will talk about, weight loss if you're carrying too much weight, and exercise. Our medicines, which we'll talk about further, are designed to decrease wheezing and to eliminate mucus, because if we're short on air sacs, we can't have half of the ones that are left full of mucus.
One caveat is that patients should not smoke with their oxygen on. This has happened in the past, and I've actually seen patients who blew up their faces by smoking with the oxygen on. And so if you're bad enough that you need oxygen, you shouldn't be smoking anyway.
So the most important thing you can do with the diagnosis of COPD or with health in general is to not smoke. Not smoking is the only intervention that's been shown to help decrease the rate of lung function decline. And this not only includes cigarettes, it also includes other smoking products such as marijuana, pipe tobacco use, e-cigarettes, etc. Something also important is to really, once you've quit smoking or you plan to stop smoking, is to really discuss it with loved ones, family members and friends so that they know your plans, so that hopefully you can get tobacco out of the environment. One, it'll help you from not relapsing, and two, it'll reduce further lung damage from secondhand smoke. So, a huge thing I always talk to patients about is, very important to get all tobacco products outside of the house. Once you remove them, spend time cleaning the walls, the carpet, just really removing all that continued tobacco and nicotine. The most success we really have in getting patients to quit smoking comes with a counseling visit or also following a counseling helpline. And that is a free number that anybody can call any time of the day to get support to help them really work through those tobacco cravings. That plus medication has really been shown to be beneficial. There's over-the-counter medications that do not require prescriptions, such as nicotine patch or gum or lozenges, for example. And there also are some medications that are prescription medications that your physician should be able to discuss with you in detail. That way you can pick which one works best for you.
If you have COPD, you are going to need or benefit from inhalers. There are more and more inhaled medicines coming out all the time.
And our inhalers, they will improve your lung function, but they do not fix COPD. They will help improve your quality of life, and they may improve your lung function a little bit, but it will not reverse COPD.
One convenient thing is that more and more inhalers are coming out in combination products, and so if this patient needs to be on an inhaled steroid and a long-acting bronchodilator, there's a combination for that.
So we look at inhalers on two broad categories, a long-acting inhaler and a short-acting inhaler. And with our long-acting inhalers, what we're looking at is trying to relieve your shortness of breath and your cough through the course of the day. On the short-acting inhaler, we're looking at that patient who's really having sudden shortness of breath that's really affecting them right now, whether it's related to something they just did or the heat or anything like that. And that short-acting inhaler will help you to get rid of that shortness of breath in that immediate time period.
They're also making the delivery systems more convenient, easier to manage. But even then, as the COPD progresses, you are possibly going to need nebulizer medicines, which is a little compressor. You put some liquid medicine into a container, and then over 10 minutes or so, repeatedly inhale that medicine, which is a lot easier to get it down in the lungs than trying to do everything at once with an inhaler and have a brief chance of getting the medicine in there.
When we try to go towards nebulizers is in patients who are having trouble using an inhaler, whether it could be from other reasons like arthritis or anything like that, or also in patients who are really short of breath, and you are at that point in time where you don't have the ability to take a long enough breath in to use the inhaler, and that's when a nebulizer allows you to take that medication over a longer period of time. With an inhaler, using it right and not breathing too fast, which can be frequently a problem, is very important. People tend to think that I have to take this inhaler really fast, and I have to push it and suck in as hard and fast as I can. And what we actually find is that you need to slow your breath down so that we're getting the medicine down to the parts of your lung where it's going to actually do the most benefit.
It is important not to inhale really cold air. You can wrap your nose and mouth with a scarf, or you can even get a ski mask type of thing. But even if the weather's 40 degrees or below, it can have a chill in the air and may trigger some bronchospasm. So it's one more thing that you can do to try to stay healthy. You don't have to sit at home in the rocking chair, but try not to inhale extremely cold air.
If you have COPD and you develop the flu, that can lead to something much more serious, such as pneumonia. So keeping up on the vaccine is key.
And obviously, use common sense. Don't get out in the really cold weather. Don't keep your routine doctor's appointment. If there's ice on the ground, you don't want to add a broken hip to the list of problems. And then the same applies to the really hot, humid air. Even for people who don't have lung problems, it almost feels like you're breathing liquid some of these humid Kansas days. So the air conditioner is your friend in the car or in the house to get rid of that humidity.
As a respiratory therapist, I love to talk about mucus. So mucus is made mostly up of water, and so when we get dry, dehydrated, the mucus gets thick and sticky like concrete. It's hard to cough it up. It all gets packed down in there. So you have to keep hydrated. Drink plenty of water. If it changes color, smell, taste, you need to contact your physician and let them know.
You've just got to be aware of your symptoms, and when they're not right, when they're abnormal, you need to be calling your pulmonologist and letting them know.
You'll know when to call your doctor, but don't wait too long. That's what's important. If you call our pulmonary specialist, even in the middle of the night, you talk to a doctor. That's really important. That's reassuring to know that you can do that. So don't wait too long to call.
If you have COPD, there is a wonderful thing called pulmonary rehabilitation or pulmonary rehab. We have a wonderful program at Lawrence Memorial Hospital. And there are many reasons to go. One is that you're already so short of breath from the lung trouble, and then that makes it hard to exercise. And so then you might sit around a lot, and so then you begin to have muscle wasting. And pretty soon you are also suffering from deconditioning along with the COPD. And so if you go to pulmonary rehab, they very carefully help you to exercise, monitoring the heart and monitoring the rate at which you progress. And so you can gradually get rid of any component that is due to the deconditioning.
Just like medications and seeing your doctor regularly, coming to pulmonary rehab needs to be a part of your treatment plan. When they come in, they're meeting with us, and when I mean us, they're meeting with a respiratory therapist, nursing, and exercise specialist. And what we are going to do for them is develop this individualized treatment plan that is going to focus on what their needs are in regards to their COPD, and at the same time develop an exercise routine for them. So we are going to figure out their oxygen needs. We are going to talk about their pulmonary medications, inhalers, and other medications. We talk about nutrition and weight management. We talk about smoking cessation, and how to best manage their exacerbations of their COPD.
You will enjoy pulmonary rehab. You have a group of peers. You'll often learn ideas, suggestions from other folks who are suffering the same things that you're suffering, and so that's a really good support group.
But it is individualized, so it's based on their needs and their capabilities as far as their physical function. And by building that strength and endurance and reducing your shortness of breath, hopefully you can then do more activities, have a more active lifestyle, and that will improve your quality of life, because that's what we're really looking at, because that's what COPD really affects.
And so what we concentrate on is how do we deal with this handicap? We deal with it by walking slower, walking more, learning how to use our medications, learning when to call the doctor if I get a cold or I get yellow or green mucus, because our role as pulmonary physicians is to keep people out of trouble and to prevent hospitalizations. Every time a patient gets hospitalized with COPD, it takes 4 to 6 weeks just to get back to where they started before they got sick. So we want to decrease that risk if we can.
Our goal is to keep you well. If we can keep you well with a combination of good follow-up with your physician, your pulmonary specialist, and pulmonary rehab, your quality of life will be better. No doubt about it. I promise you.